VA Whole Health is committed to improving veterans' health outcomes and partnering with veterans to focus on what matters to them the most. The goal of Whole Health is to provide personalized, proactive, and patient-driven healthcare. This empowers and equips veterans to take charge of their health, well-being, and to adopt healthy living practices that deter or defer preventable health conditions. Whole Health focuses not only on treatment but also on self-empowerment, self-healing, self-care, and improvement in the social determinants of health. VA offers a wide variety of services, including full body acupuncture, battlefield acupressure, aromatherapy, music therapy, mindfulness, Tai Chi, and yoga. What is battlefield acupuncture, or BFA? Battlefield acupuncture is protocolized auricular or ear acupuncture. It was developed in 2001 by Dr. Richard Niamzo for the use among military personnel. It is an approved treatment modality within the VA for generalized pain management. The Battlefield Acupuncture program originated from a joint incentive fund between VA and Department of Defense to offer access to acupuncture to veterans and service members for non-pharmacological pain management. In acupuncture, the ear is considered a microsystem of the body. Therefore, the entire body is represented on the ear. Needle placement on the ear can affect different areas on the body. BFA consists of inserting very small gold auricular semi-permanent needles, otherwise known as ASP needles, in a sequential order in up to 5 points on each ear. The needles remain in the ear for up to 3 days to provide longer stimulation of acupuncture points. There is also a method where instead of the needles, acupressure devices are used to stimulate points, and that is a gentler option. The needles are always inserted in the specific sequence, beginning on the one ear and alternating to the corresponding point on the opposite ear. Patients are asked to briefly walk after each needle insertion. Needles will fall out or are removed 3 days after the insertion by the veterans at home. The needles are covered by an adhesive band-aid so they remain in place.
My family, my kids, everything, they just think, wow, he's doing everything that he hasn't been able to do. They don't have to help me up out of the chair. And I said, I can walk, I can do everything. The family is just amazed. And I wish that everybody in the VA would try this.
Well, my wife, I think she appreciates this kind of movement that I've acquired. It just makes everything easier. You know, when you hurt a lot, you say stuff you don't really mean. You might hurt some feelings. And I find myself, I'm being kind of a better person to a lot of people.
Pain relief varies for each patient, but studies have shown 82% of patients experience decrease in pain. Average pain decreases by about 2 points on the pain scale.
I'm not afraid of walking around. My family's noticed it. I walk with my brother a lot in the mornings, on the weekends. So it's changed. It's changed dramatically.
Oh, my knees were so stiff. My joint pain is terrible. Elbows, knees, hands. And I said, after my first needle that went in, I couldn't close my hands. Now I can make a fist. And I can get up out of a chair without pain. And I can walk, and I'm doing more walking. It's the most amazing process in the world.
I'm retired. I'm a retired submariner. I like to fish. I like to have a couple beers a day. I like to see my friends. I like to visit with my family. And I've been able to do all that stuff more frequently than I have been for the previous 5, 6, 7 years. And as far as family life, my mother and sister see a difference and my godmother too sees a difference in my attitude and the way I act and the way I'm around them and able to get around the house, visit them.
Patients should not receive BFA if they're pregnant, have a fear of needles, or bleeding disorders. Patients on blood thinners are given special instruction on needle removal. Discuss with your provider if BFA is right for you as part of comprehensive treatment approach to your pain condition. If you are interested in BFA, talk to your primary care provider and request a whole health consultation for pain treatment with BFA. Since learning battlefield acupuncture protocol and offering to my veterans, I have seen a joy on their faces. I've seen initially questioning and wondering if this is going to work or is it going to be just the same or something else that I'm doing.
A life-changing moment where be in so much pain for so long and tried a lot of different techniques, pain pills, all of the above. And when Dr. Patel hit me the first time, not hit me, but did the procedure on me, it couldn't have been more than 5-10 seconds where I just felt like a total rush in my body, relaxing. And it was so long, and it's such a gratifying moment of, I got happy real quick. And I find myself being able to do more stuff now because, when you're hurt, you really don't want to do anything too much. But now I'm getting my butt off the couch. I'm outside playing with the dogs, cutting the grass, whatever it's going to be. But for me, it's a life-changing moment.
I would tell my fellow veterans this is a wonderful opportunity. If you have a chance to take advantage of it, I would encourage you to take advantage of it. There's no reason to suffer in pain like all of us do for so long and be strung out on these meds.
To witness their joy without the pain, I also feel joyful. So it also gives me a satisfaction at the end of the day.